Just one day after the Attorney General publicly announces he's putting an end to a questionable and expensive contract between CHC and ICS, a medical company from the Philippines is on island to tour the hospital and make an assessment for the same job. They're called the Medical City, and according to their website, they're based out of Manila, have over 40 years experience in hospital operations, administration, and support services. They serve over 40,000 inpatients and 400,000 outpatients annually. They're also launching a regional project on Guam in 2014 for a 130-bed hospital. This morning, reps from the Medical City met with the Governor, Lieutenant Governor, CHC's CEO Wamba Bauta, and members of CHC's board to discuss the possibility of assisting the healthcare corporation with their non-existent billing, coding, and collections. Are they being sole sourced?
No, not yet.
Okay, but why not set up, doesn't this contract need to be bid out at this point instead of sole sourced?
If that's what you want, why not?
I think it's a good idea considering what just happened.
That's right.
Okay, so is this a bid or is this a sole source?
No, they're going to go down to make an assessment.
And it's a free 2-week assessment according to CHC's in-house physician and board member Anthony Rocher.
They are aware of our situations out here and the difficulties that we're having, and they're just really want to make an assessment of where we stand right now and what kind of things that they can help us with.
Okay, because the timing is immaculate. Yesterday the AG puts his,
well,
you know.
Yes, it does sound a bit of curious, but they had been here previously, from our understanding at this meeting, that they had met with the governor months ago.
But Rocher says it's not necessarily a done deal with this company.
There's another assessment being done that's possibly being funded by the governor's office. I don't know the specifics of that, but I've heard some talk on that they're trying to do an RFP for other companies from the states to do assessments.
Director of Medical Affairs, Dr. Jeremy Richards.
I mean, if this is a plan that will work, then we'll work with them, and we just need to make sure that we do things in the right way.
What, from the doctor's point of view now, with 23 doctors that were going to walk out the door if ICS didn't go through, what's happening with that now?
Yeah, well, that was perceived as an ultimatum. It was a warning. It was that things are so bad that there's not going to be a hospital. That's the concern. If nothing happens, and we only saw the ICS as the only thing possible.
And over at CHC, some doctors agree it's not about a contract, it's just about getting paid.
I don't want to have anything to do with the contract. I just want to have my salary.
And late this afternoon, KSBN learned that the free assessment will actually be funded by a grant through the Department of the Interior.